this one's not too bad. It really isn't, all right? It's about 60, 61 slides. Probably going to take about an hour to do. Most students have no issue doing it by themselves, but I'll do it with you. Maybe some of my art therapy and other three-dimensional stuff that I'll do for you. So this is the intro to the central nervous system, Frankenstein, which is why I'm wearing this tie, okay? Very hard to find them, but I'm wearing a tie like this in the summer months for your viewing pleasure, but I'll be going into Walmart. People is like questioning, like, is it June or October? But I'm doing it for you guys, okay? All right, so, so this is what I refer to as Frankenstein. How it's all organized, in a nutshell, right? Central nervous system is the brain and spinal cord. That's the main things. There's basal ganglion. There's also the diencephalon. We'll talk about the diencephalon a little bit later. And then the peripheral nervous system, which is everything else. Okay. Again, just to so you can see it. All right. You have the brain that looks like a boxing glove. Three parts of it. That's the cerebrum, the thinking part, and his nose, eyes, mouth is like here. So his thinking part is here, the cerebrum. The cerebellum, which is over here, there's the balance coordination. And then you're going to have the brain stem, which is going to do all vital things. Things that are, you know, like your heart beating, your respiratory rate, that kind of stuff, blood pressure. And then once it goes through the foramen magnum of the skull, then it's known as the spinal cord. Okay? The peripheral nervous system is, you got the spinal nerves coming out. And how many pairs of those do we have? 31 pairs. Then we also have nerves that come out of the brain called cranial nerves, and how many pairs of those do we have? 12. Good. Okay? So what I have in black is the central nervous system. And we're basically going to talk about the coverings around the central nervous system. We're going to talk about how the central nervous system is formed. We're going to talk about the control of breathing, like the blood-brain barrier and how that takes part. And then the last thing we'll also take care of, maybe not this particular order, but the ventricles, the hollow areas of the brain themselves. Okay? Let me just grab something over here. Get to it. Sorry. So we'll get into this in a moment. All right, and this picture, you've seen how it all is organized: central nervous system, peripheral nervous system. Peripheral nervous system is broken down into two things: afferent and efferent. Right, you've seen this a few times already. All right, but always refer to this so you have an idea of where you are in this big map. Okay, you can see it this way, and also how it's broken down this way. All right, so the central nervous system. All right, like I said, the brain has these three parts: the cerebrum, cerebellum, and brainstem. You also have the diencephalon, which are these things that we'll be talking about later on when we get into the brain. But basically, they're all the thalamus, thalamus, hypothalamus, epithalamus, mammillary bodies, which is going to deal with a little bit of memory, and the pineal body, also known as the pineal gland. So we'll get into those later. Then we have the basal ganglion that takes care of unwanted movements, but it also is going to take care of what muscles to initiate first, which ones should you terminate first. All right, so that's what that's going to deal with. And then, of course, the spinal cord. So that's the central nervous system. All right, and this is all broken down. Brain, those two scary words, diencephalon, basal ganglion. This is all part of the brain, and then the spinal cord is over here. Okay? And you can see it here too. White matter, as you know, is places where myelination has taken place, and gray matter is where there's no myelination. What part of the cell gets myelination, if it does? The axons. Good. Okay. Keep in mind, the gray matter will surround the white matter in the brain, but it's reversed when we deal with the spinal cord. The white matter surrounds the gray matter. All right, so let's talk about neurulation. Basically, the formation of the nervous system. Kind of a fascinating thing. This is one of the first things that the embryo develops. Okay? And what happens here is that when we get into it, towards the end of A&P2, we're going to learn about the development of the embryo. There's three what we call germ layers that your body, or that the zygote makes, or the embryo makes. They're called ectoderm, endoderm, and mesoderm. And these three things are undifferentiated cells that are stem cells, and they can make whatever they want. The only thing is, it's like ectoderm is just going to make, let's say, skin and nervous system. The endoderm is going to make the digestive system, the respiratory tract, and the lining of cavities. The mesoderm will do blood, vessels, and a few other things too, muscles. So each one does its own thing. Well, let's talk about the ectoderm a little bit, because you'll learn about those other things later on. But the ectoderm is the one that's going to make the nervous system, amongst other things too, parts of skin, parts of the adrenal medulla and stuff. But let's talk about the nervous system. So there's a certain portion of this ectoderm that is going to develop as something called the neural plate. So if you're looking down on this thing, all right, you're looking down, and this is all, it's a bird's eye view, and you're looking down on it, and this is all ectoderm. This blue circle's ectoderm. There's a certain portion of the ectoderm that is going to make the nervous system. This here, and when you look at a side view, it's very flat. So this portion here is flat, and it's known as the neural plate. Now, the words over here, we're used to seeing big words. The phospholipid bilayer, deoxyribonucleic acid. But in this case, we're using simple words. And if whatever it looks like, it's usually what it's called. If it's flat like that, it's called a neural plate. Okay? Then what happens is this. It starts folding on itself. So there's the neural plate. And what will happen is it's going to start bending up on itself. Okay? When it does, you're going to have this groove here. What do you think that's called? Neural groove. Okay? Simple as that. You also have these two folds on either side of the groove. Do you know what those are called? Did you take this course before? Okay? You have the neural folds over here. And what will happen is, let me show you the view here. It's going to touch in the middle, and then it's going to zip up cranially and caudally until you have this tube. And do you know what that's called? Neural tube. Very simple. Okay? Now, when it zips up, it should zip up all the way to the top and all the way to the bottom. It has to. Okay? And when we learn about embryology later on, you're going to find out that most things in our bodies have started off as tubes. Your heart was two tubes that kind of fuse together and mix in turn, and you have this hollow organ. Your digestive tract is one long tube from the mouth all the way down to the anus. So everything basically starts off as tubes. Okay? So now you have this tube, and So you're looking at the tube, it touches in the middle and then zips up cranially and zips up caudally. There's the neural plate, you see the folds up here, and there's the neural groove. Okay? It'll touch on top, and then you have the neural tube. You also see these two areas that are pinching off. These are called the neural crest cells that make a bunch of different things. We'll talk about those briefly. Alright? So it touches in the center and zips up simultaneously, cranially and caudally. Okay? And it should close at both ends. This is still not closed all the way. It kind of looks like that too. Kind of an impressive thing. Okay? So this is what's happening here. You have this tube. Okay? And it's going to close up at both ends. Now mitosis takes over. The cells that are making up the tube, remember the tube is hollow, but the cells that make up the tube are going to go through mitosis. And it's going to fill in the tube. Okay? So it's going to multiply and multiply all around here. Okay? When it gets up towards the top over here, it multiplies even a little bit faster than the area down below. And it's go through mitosis and mitosis and mitosis. And it fills in. But I'm kind of lying to you, it doesn't fill in all the way. What happens here, you can see what I'm building, right? Here's the brain, here's the spinal cord. What happens here is that it doesn't fill in totally. There's going to be a space, a hollow area in your brain. Yes, our brains are hollow. Some people's a little bit more hollow than others, okay? But our brains are hollow. These hollow areas are called ventricles. But it also connects to a hollow canal down the spinal cord. What is that area called? The central canal in the spinal cord. And this will fill up with cerebral spinal fluid. Okay? So the neural groove is made by the 3rd week of gestation, the neural tube by the 4th week. It's one of the first things that develops in the embryo. The lumen, the area, the hollow areas, give rise to the brain ventricles and the central canal and the spinal cord. Okay? The neural crest, as I showed you before, those are cells that got to get pinched off. Let me go back to that picture again. These cells here on the lateral aspect of what's going to be the neural tube, these cells here are called neural crests. Okay? And they give rise to the sensory nerves, sympathetic nerves, you know, that sympathetic chain ganglion, that thing there, and Schwann cells. Okay? By the 4th week, you have the forebrain, midbrain, and hindbrain. I won't go into the details about this, but it's just giving you some idea of what's happening here. By the 4th and 5th, it's growing pretty rapidly. By the 9th week, it's all developed. It's all there. It's just going to get bigger after the 9th week. Okay? In fact, all your organs are there, are present by the 9th week. And then at the end of 9 weeks, you're not an embryo anymore. The first 4 days it's called a zygote. From 4 days until 9 weeks is known as an embryo. From 9 weeks, or the day after 9 weeks, until delivery, it's called a fetus. And then once you deliver, it's a newborn. During the embryological phase, this is the time where things are developing. The heart's developing, the brain is developing, the kidneys are developing. By the 9th week, everything is there. It's all laid down. It's just that things are going to get bigger, okay, and more developed, more specialized. So when you think about it, when's the worst time or more critical time that you should not introduce any new medications to the pregnant mother? What's that? The zygote, yeah, you can say the zygote, but things are, at that point, we haven't really talked about development, but that's where even things are just too young. You'll have like a miscarriage and things like that. That's like 4 days. But the critical time is the embryological stage, because things are developing. You're going to make the brain, and here's the 4th week, 5th week, and then you're going to introduce a new medication, and now it's going to start growing this way. You see what I mean? This is the critical time, is embryological stage. Now let's talk about reality. 9 weeks. How many months is that? 2.5 months? I mean, in actuality and reality-wise, how many women know that they're pregnant by 2 months? If you're keen on your menstrual period, sure, you have an idea. But a lot of women, I'm telling you, a lot of women don't know that. And then they start realizing, especially busy women, they're not keeping track of when their periods are. Oh, you know what? I guess I did miss my period 2 or 3 times. I better stop drinking alcohol because I think I'm pregnant. Well, this is already like the 3rd or 4th month. See, I mean, damage would have been already done. Does that make sense? Okay. Now, don't get me wrong. I'm not saying go ahead and drink at 3 or 4 months, into your pregnancy. I'm just saying this is the most critical time. Things can still go wrong. All right. Fetal alcohol syndrome and stuff. Things can still go wrong after the 3rd month, and they do. But I'm saying the most critical time is during the embryological stage, when things are developing as opposed to things are growing. Okay? All right. So, again, I'm not going to ask you about these different things here. Just understand the progression in terms of, like, when should, by the 5th week, things are already set into place. Okay? Now, what if this tube that I drew for you is supposed to close here and it's supposed to close at both ends, but it doesn't close at one end. It's left open there. So normal, as I showed you with my picture over here, or my paper, a sheet rolls on itself, touches in the center, zips up cranially at the same time. If something's left open, we're going to have what we call a neural tube defect. Okay? What can prevent this from happening, or at least I wouldn't say prevent it, but will decrease the risk of this happening, is put a certain vitamin in the mother's vitamin pill called folate or folic acid. Folic acid will decrease the risk of neural tube defects. Does that mean you're not going to get a neural tube defect? No. It just decreases the risk. If you had a child with a neural tube defect in the past, then they're going to give you 4 or 10 times the amount for your next pregnancy. If you're planning on getting pregnant, the ideal way to get it so that you will be ready for the pregnancy is that 3 months prior to you plan on getting pregnant, you should be on birth control. Not birth control pills. You should be on prenatal vitamins. Prenatal vitamins shouldn't begin when you learn that you're pregnant. It should start 3 months before to load up your body with the vitamins so that they will have a proper growth, right? But a lot of times, don't get me wrong, a lot of times when I'm working, when I practice with OBGYN, they would come to us at, like, say, 10 weeks or 12 weeks. And then we'll give them the prenatal vitamins. But by that time, things have already been developed. Most cases, things develop normally if you eat a well-balanced diet and get your vitamins that way. But sometimes you definitely need more vitamins for the growing baby, though. So that's why they have prenatal vitamins. So if you're planning on getting pregnant, and the last time I checked, I think it's 68% of pregnancies were unplanned. All right? It's a pretty high number. And of the ones that were planned, most of them are in an infertility clinic. They're trying to get pregnant, okay? So if you're planning on getting pregnant, 3 months prior to the date that you want to get pregnant, we should put you on prenatal vitamins to get your body loaded up with that. Okay? But folic acid or folate is the one that's going to decrease the risk of neural tube defects. So if the caudal end does not close, it's something called spina bifida, and that happens in 1 in 1,000 births. If the upper end, the cranial end, doesn't develop, then we call that anencephaly. Cephaly means brain, ana means without. So this literally means without a brain. It doesn't fold properly and doesn't create the tube. So I'm going to show you some gruesome pictures. They're not there to gross you out. They're there to show you examples of what can occur, because this is real life stuff. Okay. So spina bifida, there's 4 different ways that you could have this. All right, or 4 different forms, and I'll show you pictures so it'll make sense. Spina bifida occulta is the backbone is split in 2, but it doesn't affect the spinal cord itself. So the backbone is actually not developed. A meningocele, around the spinal cord, there's coverings, which we're going to talk about. They're called meninges. If we have the split here, and we're going to have part of the meninges, part of the covering bulging out there, we call this a meningocele. And the third one, so there's 3 things. So the third one is where not just the meninges are sticking out, bulging out, but also either part of the spinal cord or spinal nerves. Either one, any nervous tissue that's also bulging outside is going to be called a meningomyelocele. Okay? So this is what it looks like normally. All right? There's our backbone. There's the skin up here. Okay? So there's the backbone and there's the spinal cord. What happens here in spina bifida occulta, you will have a split in the backbone. And a meningocele, part of the coverings of the spinal cord, as you can see, is bulging out there. And if the spinal cord or any of the nerves are bulging out there with the meninges, then we call it a meningomyelocele. So another picture showing basically the same thing. You have the split only of the vertebra, spina bifida occulta. And usually, not all the time, but usually you'll also have something called a tuft, T-U-F-T, a tuft of hair. That usually happens over here. I don't know exactly the reasoning why, but I can tell you this. Ectoderm, which makes the nervous system, also makes the outer layer of the skin, the epidermis. So it's going to deal with some parts of the skin too. So you're going to have part of this occurring, part of the spinal cord getting involved, and part of the skin. So it has something to do with the ectoderm. My guess. I don't know exactly, but you'll see, and I'll show you pictures of what I mean by tuft of hair. A meningocele is where the coverings are bulging out there, and a meningomyelocele is where the coverings plus the spinal cord or spinal nerves are coming out with it. Okay? This is a side view. Again, vertebra, vertebra, and you can see where there's no vertebra here, it's open. That's the spinal bifida occulta. If you see the back, the meninges bulging out, that's a meningocele. And if any of the spinal nerves or the spinal cord itself are bulging out with it, then we call it a meningomyelocele. Okay? Okay, so let's look at some pictures. That's that tuft of hair I was telling you about. Okay? Now granted, a lot of babies are born hairy. I probably came out of my mother's womb with a beard. Okay? But the thing is, if you see this area, and it looks like this little triangle above the nape of the buttocks, right? Not saying this is a person or a child with spina bifida, but it would be wrong not to do an X-ray. So you see the vertebra all over here; they all look okay. But then when you get down here, see the split there, right over here, right? So you need to do an X-ray just to be sure. Okay? Could be a hairy baby, super. Little Chewbacca came out. It's okay. Okay? But you know, if it looks suspicious, a little triangle-like area over there, just get an x-ray. Doesn't do any harm, okay? You may have a discrete hole there, okay? You can see the hole over here too. You could have this bulge, and you don't know exactly what that is. You have to do an ultrasound to see what's there. Is it meninges only, or is it spinal nerves that's in there? But definitely you can say there's something wrong there. And you can see here too. Now this is a meningeal myocele. If you got up really close, you know, not a picture, but you can see it, you'll see parts of the spinal cord in there. What does that mean? Can they fix it? Depends. Depends on where it actually has occurred. Usually not death occurs with this, but depending on the surgeon and doing this, they might be paralyzed from the waist down. Okay? Again, it's not my forte, but it doesn't mean that the baby's going to die with something like this. Does that make sense? Because it's down below, they might not be able to move or move the legs, depending on if the urinary bladder is going to work, all right, that kind of thing.
Does it usually have the base of the spinal cord?
Yes, if it's, because it's going to go this way.
Right.
So it always starts at the bottom. But how far is it going to be? Is it just the tip, or is it going to be, let's say, you know, 2 inches or something? We don't know.
So that can actually move.
Well, no, not move. It's just that's the way it is, because this was developed early on in the first trimester. So it doesn't. It stops growing at that point. It starts being deformed at that point. All right. Now, what happens when the upper portion doesn't fuse properly? Something we call anencephaly, where the brain doesn't form. Okay. That's what goes on over here. And they have this very typical faces, the bulging eyes, we call them frog eyes. Nothing, you know, not picking on it, but when you do an ultrasound, you see these very bulging eyes compared to the brain. There's not much up there, because it didn't fuse all the way. You can see here, it's much lower. All right, the brain stem's there, you're going to get part of the spinal cord. It didn't fuse all the way. Okay? Now, I've delivered about, probably about 8 of these babies, all right? We usually pick them up at, you know, 18 weeks when they first get an ultrasound. You know, 18 to 20 weeks or so, we might see it there. Because there's no signs about it until we do an ultrasound. And these are not viable. As you can see, the brain is not formed. You know, if the brain stem's not there, they're not going to, you know, the heartbeat's not going to happen, the breathing's not going to happen. These are not viable. You can't fix this. And if the cerebrum's not formed, it's definitely not going to have, it won't be able to think, it won't be able to do much of anything. Because you have these ascending fibers going through your spinal cord, and they're going nowhere. Because the brain has not formed. So these usually die. What's that?
There's still more.
They're usually, depends on how big. You know, if it's, like if I showed you here, if it's just up here, they might be living for a few hours. But the brainstem, if it's never formed, then no. So about half of these babies I delivered, we caught them at 18 weeks. But the other half, the other 4, they came to us for late care. They came to us when she was 34 weeks pregnant. At that late stage, there's, you know, we can't do much. You know, at that point, at 18 weeks, it's up to the mom, but we would do, you know, an elective termination, abortion kind of thing, all right? If the heart rate beat is occurring, yeah, that's what we do. But you're right, sometimes the baby's not moving because it's not breathing, it's not, the heartbeat's not there, and then we just deliver the baby that way. But at 34 weeks, you know, I've had a mom come to me, 34 weeks, first visit, and the reason why she came to me was because she doesn't feel the baby move for the past 3 days. And 3 days is pretty long. We did an ultrasound, and I didn't see any fetal heart activity. You know, and I saw the bulging eyes, so I knew what was going on with this. Trying to explain that to her was a very trying time. She just didn't want to go in, and I don't even think she lived in the country, so she was afraid that she was going to get deported if she went to the hospital and stuff. So now, you know, that whole thing. So it gets pretty tough. They do, you know, it's still important to deliver the baby if this happens at 34 weeks or 38 weeks, if it reaches up to that level, that they need to have a full circle. And a lot of times, most times, we'll, you know, the mom, and we encourage the mom to hold the baby in their arms. And at 34 weeks, we definitely have to do a death certificate also. Less than 20 weeks, and it's just fetal tissue is what they consider it. But they could do, you know, it's up to them if they want to do a funeral and all that stuff. So it gets very touching and stuff. This is these are the kind of stories that you see on Grey's Anatomy and House, because these are odd. I mean, it's I've delivered over 3,000 babies, and you know, 8 of these babies were what I delivered. It sounds like that could be a lot, but when you do percentages, it's 0.0. Well, it's really like less than 1%. It's like 0.2% that this would happen, at least in my experience. So when you deliver that many babies, you do see a lot of pathology occur also. All right, questions on this? Again, this is not viable. And that's where I saw an episode of, I think it was Grey's Anatomy, where they didn't show a picture of the anencephalic baby, but they, it was all about putting the baby on life support. And for something like this, the baby is not going to, you know, you put them on a life support for the rest of their lives, it's not going to be a person like you and I would be considered a person where you're talking and, you know, doing things, because it's just gonna, it's not gonna happen. It's not viable. Eventually, something's going to give, like the brainstem gets involved and stuff. So, so anyway, that's anencephaly. Questions about neural tubes, defects, and how the neurulation occurs? Okay. So the next thing to talk about is really the ventricles. And basically we have a few different ventricles. We have the 2 lateral ventricles, the 3rd ventricle, and 4th ventricle. And then there's a connection between the 3rd and 4th ventricle called the cerebral aqueduct. It looks like this. All right? This, to me, looks like the Starship Enterprise, right? Don, da da don, da da don, da da don, 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 da. Okay, anyway. So what I want to show you is the 2 engines, all right, the 2 sides over here. Those are the lateral ventricles. The place where Kirk is going to be stationed, you know, as the captain. That middle part, looks like there's a hole in there, but that middle part is the 3rd ventricle. Back here is going to be the 4th ventricle, and between the 4th and 3rd ventricles is the cerebral aqueduct. I'll show you pictures, but the other thing I want you to see is, like, people are saying, well, if this is the hollow area, then how could this be a solid thing? How could it be like a whole thing? This is how they made it. They take a braid, they fill in the ventricles with liquid plastic. They let the liquid plastic solidify, and then we remove the brain, we disintegrate the brain, and what's left is this. So that's what this is. It's the mold of the ventricles. Does that make sense? Okay. Let me show you, if you haven't seen it, let me just show you a quick, I wouldn't say video, but of the, so this is what it looks like, so everybody can see in the back. 3-dimensional thing. So that's the ventricles. Starship Enterprise. All right, see all different angles. Okay. So those are the parts. Okay. One other thing I just want to mention too is, well, there's 3rd and 4th ventricles. Where's the 1st and 2nd ventricles? Years back, they used to call one of these the 1st ventricle and the 2nd ventricle. Now they just call them the lateral ventricles. All right? So that's where the first and second, we don't call them that anymore, but that's what that is. Now, the lining of the ventricles is going to be made up of these modified epidermal cells, which is neuroglia. This modified epidermal cells has a special name called the choroid plexus. And the choroid plexus is the one that's going to make what we call cerebral spinal fluid, CSF. All right? Cerebral spinal fluid is this clear colored fluid that's going to be made in the ventricles, goes down into the central canal of the spinal cord, but kind of like where the brain and the spinal cord meet, there's a few openings. And that fluid is going to go out of the brain area, the central nervous system, and go around the brain and around the spinal cord. So it's going to bathe this brain and the spinal cord. Okay? This should be sterile, meaning there should be no bacteria in there, should be no viruses. All right? There's some glucose and a few other nutrients, but there should be, it's clear. Okay? Meaning there's no bacteria in there. Okay? It's made in the ventricles, and it's constantly made. It eventually goes around the brain and then gets into the bloodstream because we have venous sinuses that take in all that fluid. So basically, the amount of cerebral spinal fluid that's made has to equal the amount